Hey all, today is December 6th as at the recording of this video, and I have had my surgery just 1 week ago on November 30th. So it's been a minute since I've given you a story time, so I'm going to tell you about my surgery. This is my breast cancer surgery story. Alright, so with my breast surgery, I would have finished my chemotherapy on October 17th, and the ideal time to schedule a surgery is between 4 to 6 weeks after your chemo is finished. So mine was scheduled originally for November 27th, which was a Monday. A pre-op consultation where they would have explained all the details to me. I met with a great doctor named Dr. Hannah, and he explained all of the details to me, what to expect, what I can look forward to, what are the hard parts and the not so hard parts of surgery. And he also told me that because of the nature of my surgery, because of the length and because of the amount of work they have to do, they had to push my surgery back. So sometimes your surgery gets pushed back in the public sector and even in the private sector. So if this happens to you, don't be alarmed. So my procedure was pushed back from Monday to the Thursday of that week, which means it went from the 27th of November to the 30th. So I found this out on Friday afternoon, on the Friday afternoon before. So that gave me a little bit more time to prepare in the weekend prior to that. So during that time, I was actually able to do things like clean my bathroom and clean out my bedroom, clean certain things and make sure that my living space was pristine, so that once I got back home during my period of convalescence, things would be clean. I don't know about you, but I like to clean things if I know I'm going to leave home for a period of time, if I'm traveling, if I'm going to the hospital. So when I get back, I have minimal work to do and I could just rest and relax. So I did that. One other thing I did before going into hospital is that I went and I bought a bunch of new underwear. Your granny always say make sure that you wear good underwear because you never know what could happen. So I made sure that I had really good underwear. I went and I bought a whole bunch. The irony is I probably only used a couple of those for the 2 days I was there, because it's surgery and for like part of the time I wasn't allowed to take a shower, only when I got home. But it doesn't matter because I was prepared. So it's now Monday 27th. I'm getting my last minute shopping in, and I had to check in on Tuesday 28th. Now, sometimes things don't always go smoothly, because when I checked in on Tuesday 28th and I went, and the nurses are confused, they're not sure what's going on, and so I wasn't able to check in on that day. Anyway, by Wednesday 29th, the doctor personally calls me and he says, we need you to come in early. Now, the reason for that was because throughout my period of chemotherapy, my blood count would have dropped, and this is something that's normal, that tends to happen sometimes when you take chemotherapy. Your white blood cell count drops and your blood count actually drops. So my blood count was around 8.1 or something like that, and a comfortable blood count, they needed it to be around 10, 11 best case scenario. So as a result of that, I had to go in early to get a blood transfusion, which would have taken about 4 hours for me to get. And they also needed another 8 hours to pass before they could actually operate on me to ensure that I would not have had any allergic reaction or any kind of adverse reaction to the blood that they were giving me. So fortunately, I was able to go in on Wednesday 29th, and I want to shout out Dr. Franklin, who has been such a great doctor through this entire process. He's almost like a case manager, to be honest, at this point. I see him all the time when I go, and he's excellent at his job, very professional, also very kind, and he explains things a lot. Shout out to Dr. Franklin as well. So he called me and he said, we need you in hospital at 2 o'clock. So I'm like, all right, okay. So I get down there and they set up the IV in the back of my hand. I had IV in the back of 2 hands. That was hard. And they put it up. So the doctor who set up the blood, her name was Dr. Scott. She's an anesthesia doctor, and so that's another fantastic doctor I met along the way. So I'm sitting there the day before watching my Netflix and chilling. So that night I stopped eating at around 7-8 o'clock. I go to bed bright and early on a Thursday morning. I see the lights go on and the nurses come and tell me to go take a shower, get prepared for surgery. So at this point I'm trying to keep calm. I'm not trying to be too nervous because I have prepared and over prepared. I have bought all my items, all the items I told you all about. I got my surgery pillow, my blanket, my back scratcher, all my toiletries. I have everything that I need to ensure that once I come out of the post-op room, I will be fine. And I have researched this. I have looked at many breasts. I've looked at many different things. So I'm like, all right, God, I have come to terms with what is going to happen here. So when I take my shower, I come back. The next person that comes in is Dr. Bascom. Now, Dr. Bascom is the lead surgeon down at the St. James Medical Complex when it comes to breast and oncology surgery. He is excellent. He is top-notch at his job. And he came and he gave me some real good news. And the news was that he reviewed my scans, and one thing is that I don't have any metastases, which is great. And the second thing is that he can save my nipples. Now, this might seem like a big deal, but this is a very big deal to me, because like a breast without nipples, I mean, it's gonna be there and people can see it through your clothes. But for me, I wanted it to look as normal as possible. So I'm so grateful that he was able to do that. And so far, so good with the nipple saving, nipple sparing mastectomy, because sometimes what tends to happen with nipple sparing mastectomies is that if your doctor is not highly skilled and can't do it properly, the blood supply tends to get cut off, and you go through necrosis of the nipple, which is like basically the flesh dies. And Dr. Bascom did a really fantastic job in preserving it, and the entire team did a really good job. I really have to give a big shout out to all the doctors and nurses at St. James again. Very good. And this time I'm calling their names, from Dr. Bascom to Dr. Franklin to Dr. Hannah, Dr. Scott, Dr. Bourgeois. Excellent team, and I'm sure there were other doctors on hand as well. So he came in, and I don't know if you guys have ever watched Botched. You know, like Botched, that plastic surgery show on E, where the doctor come in and they come with a marker, and they come with a measuring tape, and they come with all sorts of geometrical tools. Well, he did exactly that. He came with a marker, marked my collarbone, my chest, marked all under my boob, on the left, right, on the right side, the left side. He made all of his incision markers to ensure that he knew exactly what he was going to do. So I was just standing there with my arms out, and he's just marking it up, right? So I was like, wow, this is a lot of math. So they said, yes, it's a mixture of math, it's a mixture of medicine and geometry. So, you know, I felt like I was in good hands. So once they were done with that, the next thing they had to do was that they had to check my blood count that morning to ensure that the blood transfusion I did the night before took effect and my blood count was up. And thankfully my blood count was up. It was at about 10 point something that day. So I was clear to go into the operating room. So now I'm wheeled into the pre-op area where they are doing their final checks before, you know, I go into the operating theater. And in that area, they checked my IV, the IV line, to ensure that it was working. And Dr. Scott, who is one of the members of the anesthesiologist team, or the anesthesia team, sorry, she promised to give me something to numb my veins so that when they administer the anesthetic, it wouldn't burn as bad. Because if you're going through chemo, your veins are quite sensitive and the anesthesia tends to burn. So after she gave me that numbing medication, they wheeled me to the area right outside the operating theater. And this is where they went through all their pre-op checks. They checked my name, my date of birth. They checked that I knew what surgery I was going to get. They checked, they had all the marks on me, so everything was fully prepared. Once they wheeled me into the operating theater, which was cold as ice, they actually put a hose with some warm air under the sheets, so I was able to keep warm. And then I had to put my hands out like, you know, Christ on the cross. And the next thing I knew, they put an oxygen mask over my nose, and boom, I was out. And by the time I came to, it was nighttime. That was around, I would say somewhere between 10:30 and 10 o'clock and 10:30 in the morning. By the time I came to, it was around somewhere close to 8 p.m. at night. And when I looked at my bandages, actually, I saw 7:45 written on it. So that must have been the time I exited the operating theater. So at this point, I am out of it completely. You know, I'm kind of between sleep and wake. And I closed my eyes. The next time I knew it was 10 o'clock because they took my blood pressure, which is something that they do throughout the procedure. And they keep doing throughout that first 24 hours out of the operating room. And I closed my eyes again, and the next thing I knew it was midnight. That is when I had my first item to either drink. So they brought me some tea. and I had it around midnight. Then I woke up the next day maybe around 5:30, between 5:30 and 6:30, 5:30 and 6 o'clock in the morning. When I looked at my phone, I had a million messages. How was it? How are you feeling? This and that. Now, people were checking in, and I realized that for some reason it seemed as though I didn't come out of the operating room at the time I was supposed to come out, because my surgery was supposed to take about 5 hours, but I went under somewhere between 10 and 10:30, and as I said, I got out like minutes to 8 at night. So of course, everybody was worried, concerned. Even my mother came to the hospital, I found out, to see me, and she couldn't see me, and she was very distraught. Anyway, because of the fast thinking of my friends, and because fortunately we actually went to school with a couple of doctors, one of them actually reached out to the member of the surgical team who assured her that everything went well, and we were so thankful for that. So let's talk about the post-surgical pain now. Because of course I would have gone through the double mastectomy straight to expanders. Expanders are designed to stretch the muscle in your chest, right? Which is where they will eventually put the implant. Now this stretching process is intense, and you feel pain. I mean, the pain is not sharp like it's burning or it's scraping or scratching you, but you do feel an intense dull pain. It feels like pressure in your chest. It feels like your muscle has been overworked. That's what it feels like. And in the first 24 to 48 hours after, it could be really, really painful. So they gave me a lot of medication. They gave me morphine while I was in the hospital, and they gave me a medication called tramadol to come home with, along with antibiotics and medication for anti-nausea and vomiting, etc. So feeling that and then seeing my chest bandaged up is a kind of surreal feeling, to go from D cups, because I had pretty large boobs, to basically looking at my chest looking like a pre-pubescent teen. It was kind of weird, it's kind of weird to see it, but I had mentally prepared myself for it, so I didn't have any kind of emotional reaction to it. I know some people have emotional reactions when they don't see their breasts, but I think having my nipples kind of allowed me to feel a lot better about the operation. So in the coming days and coming home, I got my jammies out, the button down ones, and I was sleeping on my elevated pillow and trying to eat as much vegetable and fruit as possible, because that helps with the healing. So today it is day 5, and I feel a lot better than I did on day 1. Day 2, every day is a day I feel better. I went for my first post-op consultation, and everything seems to be going okay. I mean, nothing unusual. I mean, there are a couple areas of what they call hematoma, which is where blood may have settled on the skin in certain areas, but it's not alarming that it has done that. As it's expected. And so far, checking in with Dr. Franklin, he has been really, really good in terms of my follow-up and post-op, and the nurses have been really helpful and supportive as well. So that is my surgery story so far. I feel like, I don't know if people are up making videos 5 days post double mastectomy, but I feel good enough to do this now, and I feel like it's important to share that story with you. And it's important because a few things people don't recognize. They don't recognize that the doctors we have are excellent. They're really good. 2, that you can in fact access implants through the public sector if you've been diagnosed and they're removing your breasts, right? You can get implants. 3, if you have lost your nipple, you can get 3D tattooing through the public sector. I was told this when I was there. So, they really do look out for women to be able to get back to their as much as a normal life as possible post-surgery when it comes to their breast. Other types of surgeries may be internal, so if it's like cervical or prostate, I'm not sure what systems they have for those, but when it comes to breast, I have lived it, I have seen it, I've been through it, and you are in very good hands when you are at the St. James Medical Complex. So that is my surgery story. What is your surgery story? If you are going through surgery, I hope everything goes well. Just remember to take your medications. Stay ahead of the pain. So don't wait until you feel the pain coming on to take the medication. Set specific times during the day where you will take your medication. I have to take my pain meds 3 times a day, so I take it at around 8 a.m., 1 p.m., and then 8 p.m. again. And that has helped me a lot. I also take my antibiotics 12 hours apart, so I take it at 8 a.m. and then again at 8 p.m. The drains that came with my surgery, I empty those at 8 a.m. and 8 p.m. So I have myself on a tight schedule, which has helped me to manage things and feel a lot better. And I'm feeling less and less pain as the days go by. So hopefully, over the Christmas period, I can and at least rest a bit and be back to my normal self in the new year. So that is my surgery story. Guys, I hope this helped, and I hope this helped to alleviate any fears that you may have. Know that you're in good hands if you're taking your surgery in the public sector. Know that the doctors will do everything to make sure that their job is well done, and wherever they cut you is really neat, well sewn up, and that you can have your normal life back. Just give it some time. It does get better. All right, so all the best and good luck, and I'll see you in the next video.